Hello everyone. Am I audible?
Yes.
Okay. I think we can wait till the students come. Participants, we can wait for the participants for a few more minutes. Okay, as per notification, it's 7 already there in online. So we'll wait for a few more and then we'll start. The slides are visible, right?
Yes.
Okay. Okay, since it's already 4, so we'll start our session. Now, first and foremost, we welcome all of you. Myself, Dr. Arijita Banerjee, and we have Dr. Sumit Kumar from Tata Men Hospital. I am working in Dr. B.C. Roy Multispecialty Medical Research Center in IIT Kharagpur. So this is the first live session of our course, that is Basics of Mental Health and Clinical Psychiatry. Today we'll deal with the topics which we have mainly covered till week 4 or week 5. Few concepts we will discuss based on few MCQs, multiple choice questions. And before beginning the questions, I would like to say a few of give answers to few of your queries which I was going through. Now, first of all, NPTEL is the learning platform which is meant for concepts clearing, right? So we have various courses, huge number of courses which are running in the NPTEL platform, which usually clear your concepts. And when the concepts get cleared, those that will help for the undergraduate students as well as the postgraduate students also to clear various entrance examinations at the national or international levels. Now, when we designed this course, Basics of Mental Health and Clinical Psychiatry, we kept in mind our target audience as the undergraduates, the medical undergraduates who are starting from the first year till the final year, the interns, and the ones who are appearing for their medical entrance examinations. Any postgraduate students or faculties, they are always welcome for the courses. But this course was designed for mainly the undergraduate students. As we know that for the new, as per our new medical curriculum, the UG students are posted in the psychiatry department since day one, from the first year only. So you can't expect a student to understand the psychiatry cases if they are not been like trained at least in anatomy and physiology. They could understand the anatomy and physiology, the neural systems, but they won't be able to grasp that clearly in the very beginning about the clinical psychiatry. So this course has been designed keeping in mind that even the first year students could actually get the basics of neuroscience. That's why anatomy, we have covered anatomy portions, we have covered neuroanatomy, we have covered neurophysiology, which is required as per with the clinical psychiatry. And then we have moved on to the clinical psychiatry. So the course is mainly designed for them, as well as the course has been designed for the clinical psychologists who are in the verge of their career or who are also working to get their concepts cleared. And honestly speaking, the students, the medical students, they pay a huge amount of money to their coaching centers, and they go for this type of courses, particularly not this type of courses, they go for the psychiatry coaching, but here they can get it absolutely at free of cost. Giving the exam, sitting for the examination is absolutely their prerogative if they want to give the exam or not, but at least for the courses it is absolutely free, and whenever they want they can see the videos and learn and get their concepts cleared. But some of you have asked that whether the certificate which you will get after giving the examination, what is the value of the certificate, whether it will certify you as a person who can prescribe medications or counsel the patients and all. Now, NPTEL is running so many courses of different genre, not only medical science, of different genre. As I told you, it is mainly the platform for clearing your concepts. The certificate which you get, since you are getting the certificate from the Institute of National Importance, whether it's IIT or Indian Institute of Science, so obviously it will have a value in building your job resume. But are we giving the accreditation to you people? No, we are not the certifying body. We are no one to certify you that yes, you are a registered medical practitioner, you are a registered counselor, you can give the medications. We are not that. For that you have national bodies who will give the certify you, or we will where you get registered and practice. For example, in medical science, you all must be aware, whoever are from the medical background, that there is a basic course in medical biomedical research which has been running since long under NPTEL, and we have number of participants for that. Now, there the certification, there the examination giving and the certification was made mandatory for the purpose of promotion for the medical faculty as well as the other staff members, and also for the learning. So that has got their own agenda, that has got their own values. But doing a course in medical research which is run by NPTEL does not certify you as a person or as a resource person in ethics of ICMR, right? They will never give you that certification. if you are doing any certificate course in diabetes or endocrinology, many of you write, many of I have seen across many people that this person is a certified diabetologist or endocrinologist, which is actually legally and ethically wrong. They are not supposed to do that. So we are not the certifying body. Definitely, the certificate which you will get because of this course, that will help you one step ahead in your building your resume, because you are getting the certificate from the Institute of National Importance. In this case, it is IIT or Institute of Science. Uh, then I don't think you. These are the questions mostly we got. The regarding the multiple choice questions which we have set, the questions will never be directly from the course material. One-to-one question we don't give. And already in the introductory video also I had mentioned that it will be more or less on the problem based learning pattern. The more you solve the cases, the more interest you go, and we are since dealing with the clinical part, from basics to the clinical part. So that's why we have like designed the most of the cases, most of the problems in such a way. And that's why we have a clinical psychiatrist with us. Otherwise, we could have completed the course with from a basic science like instructor only. So with this, I would like to move on to few of the multiple choice questions. This because few of you had doubts in those topics. That's why I purposefully designed those questions. And also, if you have further doubts, you can just write on the like the chat box, or already the portal is there. So, Dr. Sumit, like, shall I continue with the slides, or you want to add something?
Yes, you can start continuing.
Okay. So,
Before going to the questions, like, are there any queries from the ones who are listening? Like, any that needs to be clarified, any issues that needs to be addressed?
I think the queries will be shared to us by the admin. Like,
All right then.
so now the first question is Huntington's disease occurs due to the loss of. So we have the first option, that is nigrostriatal dopaminergic system, intrastriatal GABA and cholinergic system. Then we have intrastriatal cholinergic system, and then we have GABAminergic system. So the most appropriate answer to this question will be Actually, I'm not able to go to that YouTube page which has been shared. That is not opening.
Yes, even I am facing the same problem.
This page is having a problem loading. I am getting this message actually. I don't know about Dr. Sumit.
Yes, even I am facing the same issue.
This page is having a problem loading. I am getting this message actually. I don't know about. Yes, I'm continuing with this Zoom only. So you just share the chat response to me. I mean, here. Slides. Slide is visible?
Yes, yes.
Okay. So since I'm not able to see the response of the participants, so that's why I don't know how many of you have answered to this question. So the actual answer is B, that is intrastriatal, GABAergic, and the cholinergic system. Now, if we talk about Huntington's disease, here we are mainly concerned about the basal ganglia. Okay, so what happens in basal ganglia, as we know that we have various in the basal ganglia, we have various components like you have the caudate nucleus, you have the lentiform nucleus, you have globus pallidus and putamen. So mainly on the functional point of view, if we see about the striatum and the corpus striatum, so the striatum is mainly the caudate nucleus and the putamen, and the corpus striatum is that the caudate nucleus and the lentiform nucleus, that is globus pallidus and the putamen. So the striatum consists of the cholinergic system. Acetylcholine is there, the neurotransmitter, which plays a very antagonistic role to the dopamine receptors, to both D1 and D2. So when we are talking about Huntington's disease, specifically of Huntington's chorea, that means it's the hyperkinetic features we are talking about. So what happens in the hyperkinetic features? Usually there are two pathways, as you might have seen in the lectures, the direct pathway and the indirect pathway. So the direct pathway, the output is excitatory, and the indirect pathway, the main output is inhibitory. So in our body, there has to be a balance between the direct pathway and the indirect pathway. In between, if Dr. Sumit could uh, go with the chat box, since I am with the slides, then you can just reply. The same can be copied to the, I think, the participants. So the direct pathway is mainly for the output is excitatory, and the indirect pathway, that is mainly the inhibitions of the thalamus because of the GABAergic neurons or the GABAergic fibers, that is the pallidothalamic fibers. So those fibers are the GABAergic. So whenever there is inhibition of the thalamus in normal control, I am telling. So obviously the from the output of the thalamus to the cortex will be inhibited. But in case of destruction of this GABAergic fibers, so one has to there are two pathways, as so you might have seen in the lectures, direct pathways and the indirect the voices. And the indirect pathway, that is the outer is excitatory, and the indirect pathway, the main output is inhibitory. So in our body, there has to be a balance between the direct pathway and the indirect of the thalamus. In between, if GABAergic neurons or the GABAergic fibers, that is the with the chat box and with the slides, then you can just reply. The same can be copied to the, I think, the participants. So the direct pathway is mainly for the output is excitatory, and the indirect pathway, that is mainly the inhibitions of the thalamus because of the Dr. Sumit, your YouTube is open because my YouTube is not opened over here.
Is it okay now?
At least I'm not talking now, so I don't know, but uh, okay. So this intrastriatal GABA and cholinergic system. So GABAergic neurons, which are present, that is mainly the concern of the pallidothalamic pathway, that usually gets destroyed in the Huntington's chorea, and that mainly results in the hyperkinetic features, that is the chorea. And also the caudate nucleus consists of the cholinergic neurons. Now, these cholinergic neurons are mainly responsible for the cognitive functions. So that's why we see, traits of dementia in this type of patients. Also, the deep layers of the frontal cortex gets degenerated. So that's why we get personality changes also. So not only the cholinergic or dopaminergic or nigrostriatal dopaminergic system anyway, that is for the Parkinsonisms. So it is the intrastriatal GABA and the cholinergic system. So next we have the botulinum toxin, which predominantly blocks. So this is mainly the question from the synapse. So we have 4 options, that is syntaxin, SNAP25, synaptobrevin, and voltage gated sodium channels. So we have various snare proteins in the synapse. So in the presynaptic membrane, the snare proteins which are attached to the presynaptic membrane, they are the membrane snare proteins, and the snare proteins which are attached to the vesicle. So those are the vesicular snare proteins. So we have membrane snare proteins, mainly synaptobrevin and the synaptotagmin. And tetanus toxin is the main toxin which blocks this vesicular snare proteins. And we have membrane snare proteins, that is mainly syntaxin and SNAP25. And these snare proteins, the presynaptic membrane and the vesicular snare proteins, they interact with each other in the, as you all know, in the phenomenon known as priming with the help of ATP. So in this particular case, the Botox or the botulinum toxin will predominantly block the membrane snare proteins, and most specifically, it is the SNAP25. Now, if we move on to the next question, that is impaired ability to feel fear is associated with lesions in which structure, whether it's hippocampus or cerebral cortex or amygdala or basal ganglia. Now, in this case, basal ganglia is concerned with mostly the coordinations and the motor functions. Hippocampus is mainly concerned with the memory. Cerebral cortex is definitely with the sensory and the motor functions. So the left out is the amygdala, which is mainly concerned with the emotional memory. Now, amygdala is the integrating part which integrates the various association cortex, mainly the frontal, prefrontal, and the temporal association cortex with the hypothalamus. There are various pathways for that. Also, we have the modified version of the Papez circuit, which is also involved in the emotional memory. So these are all explained in the lectures. We have the stria terminalis pathway and the ventral amygdalofugal fibers of the amygdala, which finally terminates in the hypothalamus and the septal area. So amygdala plays a very important role in fear conditioning, that is in the emotional memory. So these are the few multiple choice questions. These are specifically designed to give you an idea of what can come in your, anyway, we have the assignments prepared for you. But yes, these are the questions which from where you can get an idea. The same type of questions you can get in the your main examination also. So yes, this is amygdala. So this is the next question. I think Dr. Sumit will continue with this.
Yeah, thank you, Dr. Arijita. Yeah, good evening, everyone. So we have some questions, like next 3 to 4 questions is from psychiatry, and we will be discussing it. So the question says, 26-year-old male psychiatry trainee was put down badly by his consultant in a ward round. And after work, he went to see his mother and started playing with his old toys. And we have to see which kind of defense mechanism the person is displaying. So when you talk about defense mechanism here, it is actually the, as the word tells, hello, am I audible to everyone?
Yes, you were audible.
Yeah, sure. So defense mechanism is basically, it comes into play when the person actually is in a state of stress. And this particular situation which the trainee is, because he was in a ward round with his senior colleague, and he felt like there was some emotional turmoil, and this was he was not able to express his feelings, his emotions there at that point of time. And in order to express his inward feelings, he displayed a set of behaviors. And this was actually more manifested in the form of a defense mechanism. So what are these defense mechanisms? There are various types. So there are like mature defense mechanisms, immature defense mechanisms, and there are neurotic defense mechanisms. So like I have already listed down during my lectures. So here we have four options: displacement, isolation, projection, and regression. So displacement, what happens now considering this particular case scenario, if that psychiatric trainee would have like displaced or shown his anger towards his mother while he went back home, the anger which he was having towards his senior consultant, then that part of his emotion was being displaced. The aggression which he was towards his consultant would have been displaced towards his mother. So that is when the evo defense mechanism of displacement comes into play. So this is called displacement. Isolation is actually seen in OCD, obsessive compulsive disorder. And projection is when the inward feeling of the emotions of the patient, the psychiatric training, it is being projected towards the person who is in front of you. In this case, maybe mother or his wife or his children. So he is projecting his feelings, his emotional feelings towards the person who is in front of you. The last one is regression. Regression, as the term tells, you are pushing yourself back, you are regressing towards the, like, you're psychodynamically, you are going back in time. So the way this person, he started playing this with his old toy cars. So what actually we do when we are child, like some 5 to 6 years or 10 years old, we actually try to play with toys. We try to do something like something of our age, of that point of time when we are small, when we are young. So there we actually display the behaviors like used to do in our childhood. So here, in order to display his emotions, this particular defense mechanism, like regression, comes into play. The person, 26-year-old guy, he started behaving as a 10-year-old or an 8-year-old child. And that is how this defense mechanism of regression has been manifested. So can we like go on to next question? Yeah. Executive sees her physician because she's having difficulty in her new position, as it requires her to do or say something that will cause her extreme embarrassment. The patient says that when she speaks in public, she becomes extremely anxious, her heart beats uncontrollably. What is the patient suffering from? So, like, if we try to analyze this case scenario, clinical case scenario, there can be a lot of possibilities so that the patient can be suffering from. So there is something called psychosocial formulation. So here, the more history if you try to elicit, or considering this particular patient, considering this particular scenario, we have to think of differentials which this patient might be suffering from. Now, since very like specifically the patient has told that she speaks, whenever she speaks in public, she becomes extremely anxious and her heart beats uncontrollably. And this, whenever like a old business executive sees her physician because she's having difficulty in her new position, as it requires her to do or say something that will cause her extreme embarrassment. So there are some pickups that we have to look for. That is embarrassment. Whenever in public space, public domain, she becomes anxious. And there is physical symptoms, autonomic symptoms that the patient is displaying. So considering the four options: panic disorder, avoidant personality disorder, OCD, and social phobia. So let's try to look each one of them. In panic disorder, patient basically has a lot of autonomic symptoms, and it is not pervasive in nature. It is not present like for the particular, it is not present for us, it is just present for a specific period of time. It is not present pervasively. There are autonomic symptoms present, and patient feels there is impending doom, feeling of impending doom is there. Patient might not be having those clear-cut idea when is it having, when it is actually occurring. In avoidant personality disorder, patient actually shies away from that particular situation because of embarrassment can be thing. And this particular personality disorder starts in a very early age group. So if you think of social phobia, if you try to distinguish avoidant personality disorder and social phobia, in social phobia, patients usually has avoidant and fear. To distinguish between avoidant personality disorder and social phobia, two things has to kept in mind. In order to diagnose a patient with phobia, there has to be a fear along with avoidance behavior. So here, as three things were specifically given, that there was fear to speak in the public domain because of embarrassment. Patient becomes shy, she becomes anxious, and there are a lot of autonomic symptoms. So this particular patient basically is suffering from social phobia. OCD, this cannot be the case because this is not a like a obsession or a compulsion. This is a true fear which actually the patient is suffering from. So the answer is social phobia. The next question. So this particular question is regarding the your formal thought disorders, which is actually seen in case of psychotic patients. So there are various types of formal thought disorders, basically tangentiality, circumstantiality, flight of ideas, losing of associations. Then you have derailment. So all those things. So considering this particular situation, when asked about his address, whenever this question is asked to a patient, he began elaborating about his age, where he was staying previously, then went on to describe his native address, and finally told the present address. So here, once the question is asked, the patient fails to attain or reach the main goal of the exact difference between the tangentiality, circumstantiality, flight of ideas, and losing of associations. So in tangentiality, as the name tells, tangent. So it is like we all have studied in mathematics that tangent is the cornermost pass of the circle. The focus of information is actually getting deviated. The patient does not attains the main goal of point. So he doesn't reaches there. So whatever being asked, whatever question is being asked by the questionnaire or the ones who is examiner, ones who is asking, the patient fails to achieve the main goal and he tries to deviate from the main goal. In circumstantiality, suppose this particular question, he was being asked about the address. So the patient tries to tell something else and ultimately reaches and tells the address which he was being referred to. So there were various points, or you can say pit stops, which the patient goes about telling and then ultimately reaches the main goal, which is being asked. So the basic difference between tangentiality and circumstantiality is that in circumstantiality, the main goal is reached. And in tangentiality, main goal is not reached. Losing of association, it is the maximum form of derailment. So derailment is actually the same thing, but the intensity is much higher than the tangentiality. And flight of ideas is basically seen in mania. It is classically seen in mania, where there is rapidly change and successive change of goals. And there also the patient actually tries to reach the main goal.
Okay. So I think Dr. Sumit, you're done with your questions.
Yeah. So
Okay.
I'll be expecting like if any queries are there.
Oh, yes, we will just see the chat box. Any queries have been addressed to us or not? Okay. There is a question on gate control theory of pain. So now this gate control theory of pain was discovered by Melzack and Hall, and this gate control theory of pain occurs at the level of spinal cord. And what occurs at the level of supraspinally, that is the other analgesic system. We have the periaqueductal gray regions, okay, where enkephalins are secreted and they results in the pain control. Now, at the spinal level, that is at the dorsal root of the spinal cord, what happens if we are talking about the slow pain, the fibers which usually carry the slow pain, that is the C fibers. And we know the A delta fibers, they usually carry the fast pain. So whenever, say, suppose the C fibers are carrying the slow pain, they usually relay in the substantia gelatinosa, right? So from there, the projection neuron starts, and thus the pain gateway is opened. Now, what happens? You must have seen that whenever we apply any balm, or whenever we rub a certain portion on your body, or we give acupuncture therapy, okay, so these are the process what will cause, that will relieve your pain to a certain extent. So how this pain gets relieved? It is saying that when we are rubbing on the surface of our skin, so at that time the fibers which are taking the sensation is the A beta fibers, right? So this A beta fibers will take the sensations, and this will project on the substantia gelatinosa, and it will inhibit the substantia gelatinosa. And that in this way, the inhibition of the substantia gelatinosa will inhibit the projection neuron, which was supposed to carry the pain forward. So in this way, the gate which was opened by the C fibers, that has been closed by the A beta fibers. So that's why after rubbing or applying any balm, we don't feel the pain. So this is the gate control theory of pain, which occurs at the dorsal root of spinal cord. Any questions if you are having related to the mood disorders? I guess the week 4 and week 5, week 3 and week 4 was mainly of the personality disorders and the mood disorders. So any questions you want to ask regarding the psychosis, the mood disorders, or the personality disorders, or the psychopathology? So you are free to ask. But again, I think the admin can send us the chat response if there is any queries further. But again, I would like to tell you that we are not the certifying body to give you just after taking the certificate. Don't go to the centers and write, okay, fine, IIT has given a certificate, so I can prescribe the medications. No, definitely there are the national bodies which will give you the accreditations for practicing, even as a counselor or a medical practitioner. Okay, this certificate from Institute of National Importance will boost your career, especially when the course has been designed in a competitive manner for the undergraduate students. So from the very beginning only, it will set an idea how the multiple choice questions for your post-graduation come. And also when you go for the postings, clinical postings, you can just correlate your basic science with your clinical knowledge. That was the main purpose of designing this course.
Hello everyone, myself Dr. Chaitanya. Sorry to late join, and hopefully live session went very well. And according to the email over our for regarding our course, the many mails were regarding their test centers. So I think the technical team can reply according to that. They want to be specific in whole Mumbai, where it could be, whether it is near to their hometown or not, or suitable transport is there before admit card. So what I replied that it will all depend when the admit card will be issued. But still they want to clarify, they need a clarification over the test centers. So if technical team can help out. So many other queries which they asked, students asked, I tried to reply it. And this was a major one which Dr. Arijita has already replied regarding the prescribing the medicine. So that's all from my side. Thank you.
Yes, regarding the centers for examinations, you just write to the support team at the rate of NPTEL IIT Madras. So I think they could help you about that. Rest, if you don't have any questions, we could just conclude today's sessions. Since we have described the few questions till week 4, so we will just continue another 4 weeks. We have another live sessions. So further, if you have any doubts, you can just clarify with us, and we will further discuss few, like not many, of course, because you have the test to give and you are giving the assignments. So we will just further continue this sessions in the next session, live session. So you will be intimated with that. And thank you, everyone.
Excuse me, before winding up, I just want to add that the mail ID mentioned in the chat box, one of the student has replied that it's not working. Kindly check it out. It is for the technical team. Thank you.
Okay, I think that they will do if the mail ID is not working. I think the students can write in the in this live session also if they were having any problem. The mail ID is working actually as per that NPTEL IIT team, Kharagpur team. So if any student is facing such issues, I think it might be on their part actually. So, okay, fine. Yeah, I would just conclude today's topic. We will be meeting for the next sessions, hopefully at the end of this month. So, thank you.